Hi, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Let's talk about drug price transparency. A lot of talk about drug prices and how do I find the best price and so forth. And it really boils down to taking a moment to think about it before you actually fill your prescription. I'll give you an example. Over the weekend, I developed a rash. I went to an urgent care center on Sunday and walked in, and I said, I've got this rash on my back and it hurts and it itches and so forth. And they said, well, you probably have the shingles. Well, okay, first off, shame on me, because about 4 months ago when I was at my doctor's office, I did get a prescription for the Shingrix vaccination. Called around, couldn't find any drugstores in my area that had it, so I put it off. Waited a few weeks, called around again, and still couldn't find anybody. So I just said, well, I'll take care of it after the first of the year, because there really isn't a season for shingles. Well, it came back to bite me in a manner of speaking. So like I said, Sunday I woke up and I had this issue, went to an urgent care facility, and they said, yep, that's what you got. We'll give you a prescription for Valtrex. That's the brand name. The generic name is Valacyclovir. And so they said, I said, well, give me a written prescription. They were going to call it in to CVS, which is the closest drugstore to my house. And I said, no, don't call it in. Give me a written prescription. So I went out to the parking lot of the urgent care facility, and I got on my phone. I have a GoodRx app on my phone, and I checked prices. And so here's what I came up with. I also checked, I currently have Envision, and I checked the price there. And Envision said, well, if I went to CVS, now this is for 21 pills, 3 pills a day for 7 days, 21 pills, 1,000 milligrams, which I think is a gram, I don't know. Anyway, CVS, which is where I normally go, is $32. Kroger, which is fairly close to, is $82 with Envision. Now, if I had WellCare, and that's what I'm changing to, as a matter of fact, I changed to WellCare this year, actually just this morning rather, for 2019. WellCare has the same premium, they have more pharmacies that are participating, and sometimes they have lower pricing. As an example, the CVS price for Valacyclovir is $10. It's the same price at Kroger. Well, I don't have the WellCare plan yet. It doesn't start until January, so it doesn't really do me any good. But that's just a point of reference. Big difference. And by the way, on the Envision plan, it's a Tier 3 drug, Tier 3 generic. So, big price difference there, $32 and $82 in two pharmacies that are about 3 or 4 miles apart. So back to my GoodRx. I looked on GoodRx, and for 21 pills at CVS, it's $38. So it's more expensive than it would be if I used my Envision drug plan. But I came up, the lowest price that was at a pharmacy in my area was at Kroger, and it was $18. So I went to Kroger. And I used my GoodRx, and I got my 21 pills for $18, as opposed to $82 if I used my drug plan at Kroger, or $32 if I used my drug plan at CVS. So this was fairly easy to do. It took me less than 5 minutes to look up the prices on my phone. I could also do it on a computer, but it took me less than 5 minutes to look up the prices for my drug plan. I also could have called them up and said, hey, I've got this prescription. How much is my copay going to be, and where should I go? And if you don't want to navigate the website, and I'll tell you, their website, like most of the drug plans, is a challenge to navigate. So I could have called the Envision number, and normally I would have, but I was just curious. But the GoodRx app is very easy to use. I simply plugged in what I was looking for, and they said, what's looking for drugstores near my area? And the Kroger came up the winner at $18. So drug price transparency, as I said, is one of those things that you can really save some money. And I mean, we're talking about almost a $60 difference between Kroger with my drug plan and Kroger with GoodRx. That adds up. And this is a one-time fill, hopefully. This is a one-time fill. So imagine if I was doing this every month. You definitely don't want to just bop on down to your local Kroger store and fill a prescription, especially with that kind of pricing difference. So this is Bob Vineyard with the Georgia Medicare Minute. You take care. Have a great day.